the pituitary gland tells your ovary, hey, wake up, make some more hormone. But there's supposed to be a feedback mechanism where the estrogen produced by the ovary is supposed to go back and say, okay, okay, I got the message. Now, when you reach the menopause, there's no more feedback. The estrogen is not there anymore, it's gone. So the one that's coming out is testosterone. So many women after the menopause become more sexually arousable. The fear of pregnancy is gone.
Yes.
And
Exactly.
the testosterone level is higher in women. So the presence of an able and interested sexual partner is the one that's paramount. Of course, if you never liked it before, you're not gonna like it anymore after the menopause. But if it was something that you enjoyed together before the menopause, there's no reason why it will stop. It may become actually more
Pronounced.
arousable after the menopause.
More fun.
More fun, yes.
But is there no, I just have to ask this, discomfort?
There is some degree of dryness, but then your friendly neighborhood doctor can give you, there are vaginal estrogens in lubricants, and a little bit more patience on the part of the partner. And again, we're going to an interested and caring partner who will take the time and the patience.
And is
To do
this
these
something
things.
that they can buy over the counter?
In the Philippines, you can buy anything over the counter except morphine.
Yes, yes, I guess, yes.
Yeah.
You can buy. You
Yes.
can buy. You can buy.
And the neighborhood dispatchadora who is in the pharmacy will even be the one to tell you, oh, kini, this is nice. Oh.
This brand is better than the other one.
Which they're not supposed to do, but
Yeah.
unfortunately, I have a pharmacist granddaughter, so she's gonna get upset when they said, you can buy anything over the counter because you can. You're not supposed to, but that's
And
business.
women are not embarrassed to do that, especially if they're already on the advanced age. Or they ask somebody to do that for them.
Well, if you buy lubricant, it can be lubricant for anything.
Yeah,
It's
for
really-
lubricant for
I mean,
anything.
you know, it can be for whatever purpose,
yeah.
not necessarily for that. So I guess it's nothing to be.
It doesn't
embarrassed
have to be medical lubricant.
about. Yeah, yeah.
There's so many things that you can use.
True.
Petroleum jelly, baby oil, strawberry jam, whatever.
for as long as it does its purpose.
All you
See,
need is-
you're learning.
Yes,
You're learning.
That's something that's new to me.
Exactly, exactly. It doesn't have to be.
It makes it more interesting because you go into there. It's not just regular sex. There are so many things that can be done. Because as I said, interested and able. When you're a 60-year-old woman with a 60-year-old partner, many times they're diabetic, they're hypertensive. Many of the drugs that they use in hypertension will make them lose the ability to have performance. So you should ask about these things. Even things like things that you use for your colds to unclog your nose. They make everything constrict. And in order to have lubrication and, I don't know if I'm supposed to say, erection, it has to be vasodilatation. The blood vessels have to engorge. And if you're taking these things that make your blood vessels very small, it can interfere. So you have to go into that history. Are you taking any medications? Because
Okay.
sometimes that's all.
But how about for women? Do they also are they also affected with the medications
Of course.
that they go through? And that also affects their
It's
drive.
basically the same process.
It's
That's
the
why
same process.
that's why you go back. You asked it earlier before we started about sildenafil called Viagra. It's an off-the-counter, off-approval use that women can actually use Viagra also. Because
it
it
can
improves
also be-
vasodilatation. So when you have vasodilatation, it improves lubrication.
So it can also be used by women?
Oh yes.
But how come, Doc, that it's not yet approved as of this
Because
time?
you have to be using, these are drugs that are not essential to save lives.
Okay.
So that the FDA regulations are more stringent in trying to prove not just effectivity but safety.
Yeah, because they say
Oh, yes.
it has side effects. I mean, it could
In-
cause
In terms
heart-
of cardiovascular,
heart-
because
heart,
it was originally a cardiovascular drug, thinking that if it will dilate the blood vessels of the heart, it will stop a heart attack. But then they discovered the opposite effect on the heart.
Yes, it can cause.
It can actually constrict in the heart.
Which reminds me of another possible myth, because I've also heard that because women or men or couples on advanced age, the reason why people have the impression that they don't have sex anymore. It's because of the risk of having heart attack. Is it true or false?
The fear.
The
that if
fear.
you
Well, there was
in
a
the-
series on that. I'm sure that was very popular. That even after a bypass operation, they're allowed to have sex, but the doctor says only something a little bit boring, just with your wife.
Okay, so you see,
You see?
our discussion is becoming more interesting. So more about this when we come back.